For the reflux in the main superficial venous system, which is the primary cause of most of the problems that we're talking about, we do something called endovenous ablation. Now, in the past, the way that we handled that was with something called vein stripping, which was a surgical procedure. It was done in the operating room. It wasn't a very palatable procedure for anyone, either the surgeon nor the patient. And so consequently, many people went untreated because they just didn't feel like it was worth going through something that was almost worse than the symptoms themselves. Luckily, over the last 8 to 10 years, we have been able to develop specific technology that addresses these problems in a much, much less invasive fashion. At our vein clinic, we use primarily a laser procedure. It's called endovenous laser ablation of the vein that is malfunctioning. In that procedure, we use the ultrasound machine extensively. We use wires and catheters, but ultimately we place within the vein itself a laser fiber, and we surround that vein and that fiber with local anesthetic so that it's comfortable for the patient. And we turn the laser on, and essentially what we're doing is heat treating the inside of the vein and cauterizing the vein from the inside out and essentially closing the vein down. So rather than extracting the vein completely like we used to do surgically, the vein stays in, but it's ablated, and it eliminates the abnormal function and therefore the abnormal effect that that vein is having. Typically, we will have the patient come to the office and we use a little bit of an oral sedative like Valium. So the patient is relaxed, but they are not asleep. They're fully awake during the procedure. In addition to that, wherever we're entering the skin, and again, we enter the skin and do the procedures in a very minimally invasive way, such that essentially everything we do is done just through little needle puncture sites. Wherever we go through the skin and make a puncture site, we're using local anesthetic, Novocaine type of medication. So we keep it very, very comfortable for the patient. And most people, I believe, are surprised at the lack of discomfort that they have during the procedure. When the patient leaves the office, there is essentially no downtime. They can return to nearly all daily activities. We've had people come in for procedures, leave here and go play 18 holes of golf. Now, do I recommend that? No, but some people that's okay for. But essentially all the routine daily activities that people are involved with, they can get back to immediately. Certainly it would not interrupt most people's work schedule or family life.